But the nice thing is peptides are super safe. If someone reacts, they're going to react, but they're not going to have a negative consequence.
Share with me some stories.
I go to this acupuncturist who fixes my heel pain in like 4 visits. I'm like, something's going on here. The body is capable of self-healing.
I mean, I was going to say 90%, but it's probably 99% of the people out there like, I could probably change something.
Learn what's going on and then have solutions that help the body heal itself. I'm the sports medicine doctor. I'm supposed to be able to assess the pain. I'm supposed to be able to treat the pain, and my tools suck.
I think this is one of the biggest misconceptions in health. When we have pain, when we have dysfunction, all that is our body telling us something is wrong. Welcome back to the Peptide Pulse. I am Dr. Adam Bunder. I am the peptide researcher, and this is where innovation meets implementation. And I'm super excited today because I've got somebody sitting next to me that you all want to hear from. And you don't know it yet, but you definitely do. This is Dr. Steve Matta. He is not just a physician, he's actually a regenerative architect. You heard me right. This man does magic in practice for his patients. With certifications in family medicine, sports medicine, and stem cell therapy, and he has his MBA. You know why I'm reading this? I'm reading it because there's so much here. And again, I am so honored to have you here. Let's keep going. He's leading Philadelphia's Meeting Point Health with a model that blends functional medicine, peptides, IV therapy, regenerative injections, and movement medicine, which is so true to my heart as a chiropractor. I love that implementation. Today, what we're going to do is we're going to explore how peptides fit into this larger strategy to help restore, repair, and rebuild the body to ultimately bring human potential and human functional optimization. Steve, man, thank you for being here.
Thank you. That was an awesome intro. I'm going to steal this regenerative architect.
Do it, man. You should.
When people are going to ask, like, what kind of doctor are you? Well, I'm a regenerative architect.
You know what? Actually, you're joking, but take it, please, because it's always what about sets you aside, right?
Right.
And I think that's the biggest thing in this industry, even when we talk about peptides. I mean, that's another thing that sets you aside. And, we're here this weekend, and I've brought in a couple other physicians. I heard you speaking on stage, man, and you, there at most medical conferences, I'll just tell you, you've been to plenty. I've been to plenty.
For sure.
Half the time we want to fall asleep.
Right.
But when you were on stage, and I've spoken all over the world, just the way that you spoke and presented and shared your stories of what you do in practice, honestly, I had to have you on this podcast, because your passion, it shines when you're up there. And if you don't know that, I wanted you to know that for sure.
Thank you. That's very kind of you.
I'm glad that I ran into you because after you got off, I knew I was going to come up to you and I was going to be like, hey, would you come do a podcast? And then I didn't think I was going to see you. And then I drug you up here to this room. And we're here. And I'm so blessed again. So I would really love just to hear a little bit about your story. Like, how did you get in to, man, the titles that you have at the end of your name? I'm just like, where did that come from?
Yeah. Well, yeah. Thanks for asking that. Man, it's been such a journey. I talked about this a little bit in the talk, but sports was my life when I was in high school, and I was a high school athlete, and I just loved it. Besides the accomplishments in soccer and whatnot, I just love playing any sports, tennis or basketball, pickup football, whatever it was. Went to Duquesne University for undergrad. Kind of was already on the pre-med track. My father was a doctor. Growing up first generation, you could either be a doctor, a pharmacist, a lawyer, or an engineer. That's pretty much all you could. And went on that track, went to med school. I'm a DO, so proud to have gone to Philadelphia College of Osteopathic Medicine. And I'd say about halfway through med school, I found out about primary care sports medicine, and I thought, this is great. I get to be a sports medicine doctor, combining my love of sports and, I'm a doctor at the same time. Went through my training in family medicine, and as you're kind of gearing to be a sports medicine doctor, so I'm a primary care sports medicine doctor. I'm learning different things, and I'm doing rotations in orthopedics and primary care sports medicine. And I'm thinking, okay, when I get to fellowship, I'm going to learn how to assess pain and treat pain. And I get to fellowship and I'm going through my training and I still don't understand. I'm like, what the heck's going on here? Now, what's interesting is I did a rotation actually in physical therapy. And I remember this clinic, they were doing these things like movement screens, and talked about this guy, Gray Cook, and I didn't understand any of it. But what I was impressed with was their assessment. I was like, this guy knows how to assess the body way better than I do, and I'm supposed to be the sports medicine specialist. So I finished fellowship, and at the same time, our family's growing. I'm at this point married to my beautiful wife. We have already 2 kids by the end of residency fellowship, and personally, little things are lingering up. I sprained I tear my plantar fascia. I had plantar fasciitis. I was just getting into running, and I couldn't run because of my heel pain. And I'm in my sports fellowship, and so what's the treatment? I get a steroid injection, and it feels good, and I'm able to run. And 3 months later, the pain comes right back, and I'm like, shoot, what do I do now? So that didn't fix it.
Your reputation builds your practice. With Unify Reviews, automate review requests and respond effortlessly, turning every wellness experience into glowing 5-star ratings. Build trust, boost visibility, and grow your clinic's reputation with ease. Elevate your practice with Unify Reviews. Visit us at unify360.com.
So, and just like my general health was very important, the impact of having children and just realizing, shoot, I need to be healthy years later. So all this kind of came together at the same time. Did honestly just a year working with a private practice, and I was like, this is not what I want to do. I don't like this conventional medicine stuff. And just at the same time, I go to this acupuncturist who fixes my heel pain in 4 visits. I'm like, something's going on here. So, I'm the sports medicine doctor. I'm supposed to be able to assess the pain. I'm supposed to be able to treat the pain, and my tools suck. This steroid injection just isn't working out. So all these kind of things are coming together at the same time. About a year later, I'm at this this gym, and this really neat strength and conditioning coach does this thing called a functional movement screen on me, and then he gives me these exercises, and I'm like, what is this stuff? And he's like, listen, you need to get into this, and you need to go to Gray Cook's course, Selective Functional Movement Assessment, and you need to learn this stuff. And so I listened to his advice, and I do the SFMA, I then did Titleist Performance Institute, I did neurokinetic therapy, and I'm learning this paradigm of movement medicine.
Yeah.
And this is super cool. And at the same time, I'm kind of getting into health, and I started a plant-based diet. I was honestly, it was because I was loving running, and I'm listening to on my runs, I'm listening to these audiobooks and just go after book after book. And Scott Jurek had a plant-based, he was a ultra marathon runner, and he was on a plant-based diet and talking about plant-based diet. I was like, wow, this is pretty cool. And then Rich Roll, also sort of ultra marathon, ultra endurance athlete, also has a book talking about plant-based diet. And then Rich Roll comes out with this podcast in 2011, 2012. And, Ben Greenfield's on, and Dave Asprey, I believe, was on, and all these interesting characters. And then learned Ben Greenfield has a podcast. So, and
now you're on a podcast.
Yeah, right, exactly. Now I'm on a podcast, full circle. So, and then people like Dr. Seeds is on Ben's podcast, and all these crazy things are coming all at the same time, and I'm just absorbing all of it. I'm loving it because it's the opposite of what I was into. yeah, just from then it really evolved into what I call my medicine. I mean, it was neat because as much as I kind of diss the conventional paradigm, it's still very useful. It's great. I can read MRIs, and I'm still trained as a sports medicine doctor, so still familiar with sports medicine. So I have that whole paradigm, and I can build on that with functional movement assessment. I can know why they're in pain. I can assess their pain. And then I start bringing on these other tools. I had the hands-on manipulation skills from osteopathic school. My wife was in acupuncture school. So after I finished all that, we were like, oh, you got to do this. So she went to acupuncture school, but then we were like, well, you got to do this too. So I went and got my own medical acupuncture training, contemporary acupuncture at McMaster University in Canada. And so now I'm able to actually have some tool. And I had started also a little bit with prolotherapy, and that evolved eventually to, PRP, stem cell therapy. And then we add on ultrasound, and it was just this like neat, it was really cool. Like, if I had like, if my whatever, 30-year-old self or 25-year-old self would have been able to look at this, my current self and know that this kind of job is out there, he'd want to talk to me, and be like,
let's
this
start
is really
this
cool.
earlier. We could have done this.
Exactly. So yeah, I feel like super blessed right now to be able to do the medicine I do. It's super cool, by the way. It's really neat to, I love doing assessments, especially if someone's like really into what I do.
Yeah.
I love just kind of like figuring out like where are the pieces, what are the pieces involved, and then coming up with this plan. And, now we have multiple tools. We have regenerative medicine, we have peptide medicine, cellular therapies, infusion therapies, which are phenomenal, and still manipulation and acupuncture. I still use it all. So yeah, it's really cool.
I love it. I mean, you're a continual learner.
Yeah.
And I think,
love it. Yeah.
I always have told people when we sit down, because people use the phrase, knowledge is power. Yeah. And I said, we think that, but actually it's the application of that knowledge that is the true power.
Yeah. Because
we can hold on to the knowledge all we want, but if we're not utilizing it and sharing it, what good is it? And so I love your journey, because it's one of continued seeking not just what's the best for you, but what's the best for those that you're serving.
That's right.
And I think that's a beautiful thing. Where was it that like you had the aha moment for peptides within your practice or even for yourself?
Yeah. Yeah. There was some, through Ben Greenfield's podcast that started a little bit. Once again, I hadn't heard Dr. Seeds on the podcast. There are others. There was a peptide summit. I believe it's Dr. Talks or something like that. That was pretty. That was pretty helpful, but it still was barely enough for me to mess around with for myself. Yeah. So I had been getting these emails through the SSRP advertising their courses. Once again, at this point, I'd been familiar with Dr. Seeds. And then I finally signed up. Of course, you're a sucker for their free, module. They're one module with peptide foundations, and I heard,
in.
yeah. It's they get the free one, and then you got to pay for the other 10. And
worth every penny.
Oh, but absolutely, yeah. So I heard even the free one, and I was like, oh, that's how I want to learn peptide medicine. And man, I can talk about loving to learn. I think I whipped through. I'm pretty sure I whipped through the peptide foundations in a day. I'm almost certain I went through it all in a day. It's funny because I've talked to the SSRP group, and they were like, some people barely get through 3 modules, and I was like, are you kidding? So that was definitely oh yeah, this can be really, really good medicine.
So you said, you were watching that first module and you're like, aha, okay, what was it about the first module and peptide therapeutics that what was that exact moment?
Yeah. So It was the fact that it wasn't like a supplement, or, it wasn't just like take magnesium, take glutathione. It was the fact that we're dealing with the cell here.
Mm-hmm.
I've always been the why guy, the why kid, like why. And the fact that like, okay, this is making a cellular change, and there's a reason for it. That's what did it for me.
Yeah, through life, and we've all had our journeys. I mean, I'm 62. So I know, right?
Wow,
not really.
job.
I'm 44, but I do tell people peptides and regenerative medicine do this. But that's the one that I get laughs on stage. You got the one with methylene blue.
Exactly.
But I've even switched it even more to like there's the whys, but I've been moving more towards like the what.
Yeah.
Because even in medicine, and I think that's where peptide therapeutics is moving as well. As what is it actually doing? Why is the body doing this? And what is it that the peptides are going to do to then transition that?
Yeah. Yeah. I mean, that's the cool thing about peptides. What I always like to bring it back to is that, they've done studies on in utero, right?
Mm-hmm.
And, they'll operate on the babies in utero, whether if there's like a spina bifida, and they come out with no scar. Even like, and I believe you said, you were sharing with me, our mutual friends got a newborn, right? So when our kids were like, 6 months old, a year old, if they cut themselves or whatever, they heal super fast.
Mm-hmm.
So our bodies have this innate ability to repair, right?
Yeah.
But, there's tons of, just stem cells. They're just stem cells, and our peptides are like super strong and active at that young age. So the key point there is that we have this innate ability to heal and repair. It's there. And over time, over decades, that dwindles decade by decade. And the beauty of peptide medicine and regenerative medicine is that we're just tapping into that self-healing capability. As a DO, this is like one of our principles, right? Is that the body is capable of self-healing. The body is a unit, and we just have to tap into that pathway. And so, this is the reverse of that is a pharmaceutical. It's just like we talk about Band-Aid solutions. So much of it is unfortunately blunting that natural response. Versus, and this prolotherapy was pretty pivotal too. I'll give a shout out to a leader in the field of regenerative medicine, Dr. Brian Scheipel. I had the opportunity to do a rotation with him in med school in 2006. And he, this is the first time I saw prolotherapy. And the fact that they were like, it's kind of the opposite of a steroid injection. Instead of taking away inflammation, we're inducing inflammation to help the body heal. And I was like, this is super cool. And he had all these patients that were having chronic pain and doing better. And it wasn't a steroid injection. And I was like, this is awesome. This is what I think we should be doing.
Yeah. I mean, it's the concept of the hormetic effect, minor stresses. So many people talk about, inflammation's bad, inflammation. Well, inflammation is actually the healing process. It's the chronicity of that inflammation or the dysregulation of the communication of the cells that creates the issue, or that state of dis-ease, which we then all know is disease.
That's right.
And all we have to do is we need to just reconnect the pieces. I talk about peptides in and of themselves. They are the cellular language of the body.
Yeah.
And I think it's just a beautiful thing. And I've done a few presentations on like human optimization, human potential. And, when you talked about it, when I first started, I was stem cells, exosomes. And I thought, man, now I'm in peptides. It's like a perfect flow through because stem cells release exosomes. What are exosomes comprised of? Proteins, peptides, mRNA, microRNA, all these really cool things. And we just keep getting down to more and more specificity. And I think that's the beautiful thing about where I believe medicine is moving.
Yeah.
And we have to continue to share this type of information to help others get there, Yeah,
it's interesting what you mentioned about inflammation. Like, the term reactive oxygen species, it's like, oh, you got to block it. It's like, hold on a second. These are messengers. If we don't use some of these cytokines, I mean, we talk about stopping cytokines and inflammatory.
And for listeners, tell them what like reactive oxygen species, cytokines, what are those things?
So these are like messengers in the body. These are like, interleukins and complements that are responsible for, triggering your white blood cells to come to the area, or in an injury, they communicate with your local stem cells to bring healing and repair. So you think of like an ankle sprain, actually, because I do PRP, I talk about this all the time. As soon as you cut yourself, your body immediately is trying to stop that bleeding from happening. So your platelets go to the area. We know platelets are meant to stop bleeding, and as soon as the platelets go and plug up that wound, there's these alpha granules within the platelets that send reactive oxygen species. They send messengers, these messengers that talk to your local fibroblasts, your local stem cells, to come and heal right away. So, but there are these messengers.
Those MSCs that people talk about.
Exactly. And that's the thing, is the stem cells are right there. Like they're literally right next to the wound. Like your fibroblasts, the MSCs that are meant to eventually make that skin whole again, need a signal to get recruited to the area. So the recruiters, they're also like whenever you sprain your ankle and the ankle swells up, those are cytokines. Those are reactive oxygen species that are flooded into the area. Well, once again, if you have an infection, you want reactive oxygen species to talk to your white blood cells to kill that thing. So, we need reactive oxygen species, but unfortunately, listen, if it's too much, yes, they're still harmful. They're still inflammatory. If there's too much cytokines, that's not a good thing. We don't want too much, but we don't want zero at the same time. We need, and especially in regenerative medicine and peptide medicine, we need reactive oxygen species. And we also do ozone therapy, and ozone creates reactive oxygen species, and we call them ozonites or whatever. But that's essentially what happens, is that ozone combines with the water, the lipids, and the albumin in our blood, and creates these reactive oxygen species. They're, these downstream ozonites, and those are what talk to our mitochondria, that talk to our white blood cells to do what they do. That's the benefit, you get from all these therapies. So
yeah. So we're talking now about the body basically in a state of dis-ease or chaos. Share with me some stories, some clinical stories. I already know which one I want to hear because you've already shared it here at this conference, but where peptides have played a role in really creating a calm. And it's not even a calm, because like you said, you don't want to be at zero with this. So your body, I think this is one of the biggest misconceptions in health. When we have pain, when we have dysfunction, all that is our body telling us something is wrong.
Yeah.
We may not know exactly what it is, but again, I love peptides because it's not like we're telling them what to do. They go in and they have, it's like that lock and key mechanism. It knows where to go. It knows what to do. So I'd love to hear some actual clinical stories where there's been that chaos in the system, and even maybe a surprise story of where you've utilized peptides and you've seen transformation even unexpectedly.
Yeah. I was just sharing this story. So this is my favorite story. 18-year-old volleyball athlete. Going back, I knew the mom. I had treated the mom. I treated this athlete. So the female athlete treated her brother, and I treated her as well. So I treated her for her knee pain in the past. And so I knew the family, like they were near and dear. And so she comes in, she's senior year. She comes in a walking boot, and I'm like, oh, what's going on? And they tell me the story. She had played, she had played a season of I believe her volleyball, high school volleyball season was in the fall, and she had overdone it. And she had started to develop what she thought was shin splints. and they never went away. She went to the orthopedist, and they took an X-ray, and he said it's a stress fracture. Now, she's definitely an elite athlete. She's got D1 schools all knocking down her door, and she's got 2 national AAU tournaments coming up where there's going to be a lot of D1 schools, and this is going to like dictate her life basically. And so when they went to the orthopedist, he basically said, listen, you need 8 weeks in a boot, and you're not going to make these tournaments. And so they walk in, and I see and talk to them, and they're like, Dr. Matta, is there anything you could do? So I examine her, I see the MRI, sure enough, there's a stress fracture, confirmed it also with the ultrasound. And I was like, listen, we have peptide therapy, and, now a stress fracture is basically a situation where, you have these 2 things going on in bone building and bone breaking down, osteoblast and osteoclast. So stress fracture is a situation where there's too much osteoclastic activity happening because of all this repetitive stress to the area. So I said, we can maybe use these peptides to really help build the bone and speed up recovery. But no promises. But I had actually had a couple of cases that went pretty well before her, so I was pretty optimistic. She was super dialed in, super clean, and I felt like this might work. So I put her on BBC 157 and GHKCU, and I said, listen, you got to do these twice a day, inject right near the fracture site, and you got to stay in the boot, and then just follow up with orthopedics. We'll see what they say. So full transparency, I hadn't seen her for a little bit after that. I didn't know what happened, but mom came back in actually with the son a few months later, and I was like, what happened to her? And she's like, Dr. Matta, you're never going to believe this story. She's like, I went to the orthopedic. We went back to the orthopedist. We did everything we said. We did all the peptides twice a day, kept staying in the boot, otherwise rested. We went back to the orthopedist, and the orthopedist pulls up the X-ray, and so they had done the peptides for 4 weeks, and it was 4 weeks later, and the orthopedist pulls up the X-ray, and he's like in shock and awe. He like can't believe what he's seeing, that the fracture is healed. And the mom said, well, can she play? And she said that he was almost like upset about it. He was like begrudgingly like, yeah, like he couldn't believe that this medicine could work. Right. So great, cool story is that she's released. She plays in both tournaments, gets a D1 scholarship, and is now playing D1 volleyball. That's like the coolest thing, like the fact that this medicine can like really change someone's life is like phenomenal. I mean, and that's just like, that's a great situation where we're able to, just, think about the disease process and say, all right, this isn't just like hacking it. This is just like, all right, we thought about what we can do, and that these are the tools and resources we can do.
Why did you choose BPC 157 and copper?
Yeah, so those are more of my repair peptides. When I think of like healing and repair, now BPC 157 is really well known for healing, for decreasing inflammation, swelling, and I use it for that all the time as well. The copper peptide is really neat. It's more well known in like the wound healing, and so that's what I was thinking about with that. It's like, okay, well, the cortex is broken, so that's almost like a wound. So what if we used a more healing peptide to target that? Now, could the same have happened if we used like a TB500? Yeah, maybe. But in my opinion, I felt like if we're really like we're dealing with a fracture here, and I really want healing and repair, and I thought, all right, let's use the combination of those two, and that is definitely my combo. If I'm really trying, like if someone has like, I treat a lot of labrum tears, and I'm really trying to like get something to heal and mend, I tend to like to throw in GHK copper. Yeah.
I love it because that's even a little.
Oh, good.
I know I do. I think that's incredible. It's even a little outside of what, because most people always go, a BPC TB.
Yeah.
The Wolverine stuff.
Yeah, for sure.
But,
Yeah. And you can do all three, by the way, too. I actually just literally right before I came here, I have a patient, once again, well known, and she was funny. She's just gotten into tennis in maybe the past year, I think, but loves it. And it's the fall. It's like super tennis season up at the club, and she thought she just kind of tweaked her quad, and she's kind of tough. So she's pointing to where the pain is and all this stuff, and I was like, all right, well let's look at this thing on ultrasound, because usually a quad thing is either like a tear or nothing, and it's been a couple weeks. So I scan her with ultrasound. She's got this rather large grade 2 tear of her quad. And she's like, "Oh, really? Like I thought it was nothing." So I was like,
"I'll share my story with you here in a second."
Yeah. So I was like, "Listen," and she's like, "Well, do I have to stop?" I was like, "This thing is going to linger if we don't treat it. So we can either rest or we can try to go after this." So I said, "Listen, let's get everything we can on board." And she's like she's obviously super tough. Like it's like playing still with this like super quad super quad tear. So we actually get her on my schedule next day for PRP. I already put PRP in the tear. And I was like, same thing. Like we're going to do twice a day BPC, twice a day TB500, and twice a day GHKCU. And I was like, we'll see how it goes. I expect it to be at least a month. And that's like super aggressive, by the way. Like we're being, I don't even want to say conservative because I feel like conservative, but like super optimistic. Now I do think it's going to heal within 3-4 weeks. I'm not going to tell her that, but she wants to get back into the tournaments as soon as possible. So you can use all three, and that's what, we did twice a day with the volleyball athlete, and I think that it's about as tapped out as I feel comfortable. I have one other patient that's like, can we do more? I'm like, let's try.
What are you typically dosing that like twice? Are you doing a 1 milligram of BPC twice a day?
Yeah, 1 milligram BPC twice a day. I think it's 500 maybe of TB 500 twice a day, and GHKCU I think it's 2 mgs twice a day.
Yeah, that is more aggressive. I mean, is.
But the nice thing is peptides are super safe.
Yes.
If someone reacts, they're going to react, but they're not going to have a negative consequence. And if they don't react, they don't react. The toughest thing with GHK is that it burns, right?
Yeah.
But other than that, we're good.
Yeah. You've talked about like your injury from running. You've talked about that. About a year and a half ago, I was a sprinter. Okay. So I was a sprinter. I was a long jumper, played football, and moved to Florida. And all of a sudden I just start running. And maybe it's because I came from Kansas City and half the year it was freezing cold. I didn't want to go outside, and so I would run 3 miles one day and then 4 miles the next, and then maybe do a sprint day, and then I'd go run 13 miles. And so I was doing all this, all of a sudden my hip starts hurting. I'm like, man, what is this? And I just kept running. And I kept wondering, then everybody's making fun of me because I'm limping everywhere. They're like, Adam, why are you limping? They actually handed me a fake cane to tell me to start walking around. Like, come on. So I went and did PT. I did everything. Finally, I'm like, okay, this isn't getting better. I had an avulsion fracture.
Yeah, of course.
Psoas, old, non-displaced.
A psoas avulsion. That's not
so.
Wow.
Yeah, it was interesting. So, but I'm like, okay, BPC, TB, copper.
Yeah. Nice. Good.
So
good.
I mean, I'm right with you, man.
There you go. That's the formula.
Yeah.
In wellness, every second counts. With Unify messaging, clinics connect with new leads instantly, turning inquiries into appointments faster than ever. Quick responses mean more patients and stronger growth. See how AI-powered speed-to-lead capabilities are helping wellness clinics thrive with Unify messaging. Visit us at unify360.com.
there's one more story. We haven't shared this one yet. And this is the one that I really want the listeners to hear.
Yeah.
Because to me, it's, when it comes, we know that peptides have these effects. We just talked about this, but it's, to me, what I've seen, even in some GLP-1s, I say, people's lives can be changed when GLP-1s are used properly, because it's helped people stop drinking addictions, even smoking addictions, and all of these things. That's not even what their expectation is. They're just trying to lose weight. I like to say lose fat. If they're done right. But tell this story, because this story, it hit me. My clinic back in Kansas City, we worked with the Military Foundation, and we were doing stellate ganglion blocks with MSCs.
I love
we were doing all kinds of stuff. And so this story was like, wow, people need to hear this.
Yeah. So this is a Special Forces soldier, and I'm just so thankful for our soldiers that fight for us. And he'd come in and he'd heard about peptides. I think he had some friends, maybe had done some. Story was he had just history of bilateral labral tears, some degenerative disc disease, and he had enough shoulder pain that he wasn't able to work out. And this is a Special Forces, performance was his life. He'd been a Special Forces soldier for 10 years, and he's used his entire being, I felt like, revolved around him being able to do anything he physically wanted to. But he got to this point where he wasn't able to work out anymore. And he came to us for pain, and also maybe to get stronger again and get back to where he was. Now, also part of the story was that he basically had some brain injury due to his line of work. I mean, biological weapon, whatever you want to call it, induced injury to his brain, and he would have these episodes of paralysis and just slurred speech and brain fog and just super shut down. So my goal with him, we're talking about his goals and my goals. So his goal was just to be able to work out again. Now, he did share with me that he's like, Doc, if I can't get to back to where I was, I don't think I want to be around anymore. And so that was very impactful to me. But I thought, all right, let's start and build some trust. So, we put him on a program of peptides. Now, I also do manipulation and electroacupuncture. So, I'm used to treating pain. And so we put him on BPC 157, TB 500, and then we put him on the growth hormone peptides. And then I also did, I did electroacupuncture on. Now, he also had some other motivations. He'd just started business school in Philadelphia, and he was, half of MBA school is networking, and he was like, is there anything you can do to help me with that? So we came up with this program with the growth hormone peptides as well. And then, so Oxytocin, and then CMAX and Selank for kind of those social situations.
Why those two?
CMAX and Selank?
Yeah. Explain a little bit just into those.
Yeah. Well, first of all, Oxytocin has some neat properties. Now, it's sort of it's released, with mom and baby. Actually, it's like the connection hormone, released naturally, and but used as a peptide, it has some interesting properties, particularly things like connection and social interaction. It helps with that. So that it's a great peptide. It's nice as it comes with a nose spray. It also is like a vasodilator, and has these interesting properties, these neuroprotective properties in the brain. So You can use it before a workout. It can be definitely almost like an NO boost, right? It'll vasodilate and nitric oxide boost. So you can do it before a workout, but also you can do it before, you're going to hang out with people. CMAX and Selank. So Selank is like, it's like my better alternative than a benzo, right? Or like a glass of alcohol. It works on GABA. So GABA is like our chill hormone. So it boosts GABA. But the neat thing, so this is Selank. So Selank's a little bit more of like a chill out peptide. CMAX is a little bit more of nootropic. So I like to do CMAX more on days where I need to focus, I need to dial in, and it chills you out a little bit. Selank is more like on the weekends where I just try to relax a little bit. So you can use a combination of all three of those, which is neat. Now, I try not to do CMAX and Selank on the same day. Some people get headaches, some people don't, but that's where I'll kind of alternate those. But so we had them on all three of those. Yeah. So, I mean, of course, this guy is like basically superhuman. So, we had to do some dosing adjustments. Initially we started at 100 micrograms twice a day, and then he had a headache, and then we back down to 50, and then he did find 50. He's like, well, can I do it more? I was like, yeah, sure. You can do it 3 times a day. You could actually go up to 4 times a day you have to really, you
have to plan that out.
You have to plan it out because it's got to be 90 minutes away from a meal before you do it. And then another about 30 minutes or so, after you do it before you can eat. But hey, if you're able to do it, you're able to do it. So it's like, yeah, sure. You can do it 3 times a day. And then he tolerated 3 times a day. He tolerated the 50. He's starting to notice some change, and then we went back up to 100, and he tolerated that. And man, he came back. Now, when we're doing acupuncture every week, and I'm seeing him, and his shoulder pain is getting better, but he just became this just like beast, man. Like he was so big, and I'm like, am I the only one noticing this? Like, you look great, man. You look strong, and you just look amazing. He's like super happy. His pain's better. He's loving the Oxytocin. He's loving the CMAX and Selank. Now, this was the interesting thing is that when he's on these peptides, his brain stuff, all these episodes are like better. And he's not really connecting the dots, but like it was a neat way for us to be able to, once again, I had my goals and he had his goals, but it was a neat way to be able to sort of treat into some of the stuff he was suffering from almost like a little sly about it, like being a little like backdoor, but he responded really well with the pain, and I mean, like because he did so well, like he went on to do great things.
I love it.
Yeah.
It's so good. It's just knowing that you can actually find and utilize peptides to help with what he's needing, but also that underlining, whereas a physician, you're like, you also need this.
Yes.
I know you're not you don't think of this at all, but it's there.
Yeah.
Yeah, it's incredible.
Yeah, no, it's really cool. I mean, these cases are like super rewarding, Yeah.
All right, so I want to do something with you real quick. This is going to be a speed round.
Speed round.
Okay, speed round. So I'm going to ask you a question, just a response, quick response. First thing that comes to your mind, your go-to peptide pairing with any regenerative injection.
I would say TB500.
TB500. Most impactful stack for MSK or musculoskeletal repair.
Yeah, we said it. TB500, BPC 157, and GHKCU.
Favorite peptide route? Sub-Q, IV, sublingual?
I'm going to go IV.
Okay.
Yeah, we do IV peptides in our office.
One principle you teach your patients about healing?
The body is capable of self-healing. The body is capable of self-healing, and we just have to tap into that.
I love it. I love it, man. All right. So all of your systems that you blend, I know we've talked a lot about peptides, from obviously the biology, the movement, the mindset, because you address all of those things, and to obviously a full healing experience. What would you say to another practitioner who's still stuck kind of in treating just symptoms? And again, it's not that we don't treat symptoms, but that's just not the underlying reason why we do that, instead of just patterns, I guess.
Yeah. I'm a why guy once again. So I would ask them, and I would have them ask themselves, why will this get better? If we just throw pharmaceuticals, if we're not like, my advice to these practitioners, and I hope that they're interested in what we're doing, and especially if somebody's interested in this, learn what's going on and then have solutions that help the body heal itself. I mean, I think that's the biggest thing is like, why I always ask myself, if I do this, why will it get better? And I think when you ask yourself that, and wrestle with it, and if you're putting out a therapeutic that is only covering things up, then it's great if it allows someone to function, but as soon as they're off of it, it's going to go right back.
So with that real quick, I mean, do you feel like people should be on peptides, I guess, forever?
I have this question all the time. My patients are like, well, I don't want to be dependent on anything, and talking about GLP-1s, I have this conversation with GLP-1s all the time. And it's like, well, are you okay with where you're at right now? Because if you're struggling with weight or fat or injury, you have a choice. You could either do these safe, effective, things, use these peptides, these things that are in our body, or you could be dealing with the stuff that you're dealing with. And so whether it's same thing for testosterone, people are like, I don't want to be on it forever. It's like, well, that's a choice you're making, and it's not a negative thing. This is different than like, we're not dependent on a benzo here. Like, we're not talking about like a drug you're addicted to. We're simply talking about stuff that allows us to operate the way that we can. Once again, it goes back to, for me, it goes back to like me with my wife and my kids and my family. I want, I'm 45. I want to be not not functional 45-year-old dad. My son's golfing right now and we're golfing together. And I want that to be happening for decades. I want the four of us to be able to hang out. I want to, be playing golf and racket sports and hiking with my wife until, decades to come. And so I have a choice. I could and yes, there's other aspects to health and those are all great. But if I can still perform the way that I want and like to, and all I have to do is these peptides, then yeah, keep on it forever. I'm going to stay on it forever. And
I'm with you.
And I have no desire to go off of it. And I think that once again, is your choice to have whatever pain or whatever you're dealing with, or to just take a pill or do a sub-Q injection.
Yeah.
That's your choice.
Yeah. And I mean, obviously there's always an underlining reason as to why they're asking that question too.
Yeah.
I always told my patient, we invest in what we value.
That's right.
Yeah. You want to brush your teeth every day? If you don't, what do you think's going to happen?
Exactly.
It's just different tools, like you've said before.
Tools.
So
yeah. And these are just great things. They're just great things. It's it's amazing to like whether it's a GLP-1 or a growth hormone peptide, and it's really nice. You go. And a few years ago, I wasn't rocking them, and then I got on the GLP-1s myself, and I'm like,
yeah.
Wow, this is really cool. I remember this guy. He looks good. This he looks familiar.
And your
I'm
wife's
looking in the mirror.
He looks good.
Yeah, exactly. And to be able to do sports and activities and not feel like you're in pain and you can't do it anymore. It's really nice. It's really nice.
Well, I don't want to go too far into this, but maybe I do. I go deep into a lot of these things, but I'm on a GLP. Actually, 3 right now. I'm on retatrutide.
Retatrutide.
Yep. And you look at both of us. We're not overweight. We're not the traditional mindset of somebody's on a GLP-1, 2, or 3, whatever it is, because our point isn't to try to be losing weight. It's for health.
That's right.
I think that's the biggest thing that hasn't been pushed out there.
Right.
In the understanding of these GLPs.
Yeah, and this whole conversation is. It is for health, 100%. There, of course, like, what do they call it? Fat shaming culture or whatever, man, it really stinks because, there, even when we have these solutions that are once again good and healthy, there's like a negative context to it. But when you do like lose weight, lose fat, look good, and feel good, and you look at yourself, there's just like it helps self-confidence. I want to say it's even boosted our marriage a little bit. Like we're more interactive. Like it's just like nice. I can't. And so once you do that, then you're like, well, why would I want to stop this?
Why would I want to? Yeah.
Why would I want to stop this? It's not about like, everybody thinks it's image. It's like, this is about like me for my health and me for my wife as well. Like I want to look good for her, and I don't want to, go off the rails. You know what I'm saying?
Yeah.
Like I want us to be together like this.
Well, I think if you ask anybody, ultimately deep down, like just the person walking by, like, do you feel as good as you think you could?
Right,
do you think that you're healing as well as you could? Are you experiencing life?
That's right.
The way that you really feel like you could?
Absolutely.
I guarantee you. I was going to say 90%, but it's probably 99% of the people out there. Like, I could probably change something.
That's right.
And
right.
To me, that's a power that, again, it's a tool, but the peptides can bring.
Yeah. Absolutely. Yeah. And it's so neat that there's like so many, and some work really well for this and some work for that. But that's like, I'm always like, we didn't, I feel like the gut peptides don't get much love, you mean
the second brain of the body? That's all it is.
Yeah, I know. I didn't even talk about lorazepatide. I love lorazeptide. It heals.
You said you loved your wife.
I know. She comes first. But
and then lorazeptide.
I'm loving my wife by loving lorazeptide.
There it is.
Right? Yeah, great peptide. He heals these gap junctions. People think about leaky gut. Gap junctions get opened up a little bit too much. That mesh filter that the gut is supposed to keep out the harmful stuff isn't working the way it should. And then you end up with crappy stuff in the bloodstream. So lorazeptide heals these gap junctions. But even in my own personal story and dealing with head injuries and whatnot, my gut, will throw me off almost more than anything. I like, unfortunately don't get to partake in these wonderful Four Seasons desserts. They look phenomenal. But I don't touch the processed sugar like that. So, and I know because the gut will really, really throw me off. So, but there's some great peptides out there. Yeah.
Keep learning, keep researching. That's to tell everybody.
Right.
That is what the Pulse is about, is to keep diving deeper, because, even launching an episode a week, I'm like, I don't think I'm ever going to be able to end, because there's going to be new peptides, new journeys that are coming out. Research just continues. With that, Doc, thank you so much, man.
This has been fun.
This has been a blast.
Yeah,
cool. Hopefully we can do this again sometime soon.
I'd love that. That'd be great.
So for listeners here, I'm Dr. Adam Boonder. This is the Peptide Pulse. Thank you so much. Until next time.